Just like a building, our body relies on our skeleton to keep us structurally sound. But what happens when that frame begins to erode, and how can we keep that from happening? Well, the Orthopaedic Specialty Group is here to answer some of those questions. So, Dr. Barnett, tell us a little bit about the Orthopaedic Specialty Institute.
The Orthopaedic Specialty Institute is a group of orthopedic surgeons that came together in 2001. And basically we are all 16 practicing orthopedic surgeons that specialize in various disciplines within the field, such as hand surgery, joint replacement surgery, spine surgery, trauma, sports medicine, and foot and ankle.
And what types of services are offered here?
In addition to outpatient orthopedic care, we have a surgery center that we can do outpatient surgeries in. Those are surgeries where patients will go home the same day. We have physical therapy, digital radiography, and MRI examination, as well as pool therapy.
So you're really able to work as a team here to create the best client care?
Yeah, we are all located in one facility, and basically we treat patients as a group.
Well, I treat any pathology of the spine, so that means anything from the neck all the way down the tailbone. Of course, we see a lot of patients with back pain, and we see a lot of patients with neck pain, but probably more commonly we see patients with pain radiating down into the arm or pain radiating down into their legs. On the occasion also we'll see some pediatric patients, and you know, I'll treat their deformities such as a scoliosis or what we call a spondylolisthesis. Yeah, any pathology of the spine. Yeah, you know, if you look at the numbers, I see anywhere between 70 to 100 patients a week in the office, you know, and we operate, you know, I operate on anywhere between 4 to 8 patients a week. So if you look at that as a whole, then on the average, over 90% of the patients that I see in the office never need any surgery.
My specialty is total joint replacement, and specifically what that is the treatment of arthritis, and for the most part this is arthritis in the hip or the knee joints. What we do is when the arthritis gets bad enough that it's becoming a disability for the patient, then these patients are candidates to have a joint replacement, where we will surgically put in a prosthetic hip or a knee replacement and allow them to get some pain relief and get better function.
I mean, the truth is that surgery should be the last resort, right? I mean, I'm a doctor first and a surgeon last, and so if I were a patient, I'd want surgery to be my last resort, and that's exactly what, that's the exact philosophy that we present to all the patients. Well, I think our philosophy is that we treat all the patients as if they were either ourselves or our own family, and I think if you have that philosophy in mind, you'll care more and you'll pay attention more to the details. I mean, it's my responsibility to be a good enough communicator with them to be able to engage them in a conversation and tell them, you know, here's what's wrong, and this is why you feel the way you do, and here are the possible treatment options. You know, ranging from really the most conservative, which is physical therapy, up to, you know, and advancing to perhaps injections, and really again to the last resort, which for some people is surgery.
After you complete this type of surgery, what kind of rehab does someone have to go through?
For the most part, after we complete the surgery, the patients start physical therapy the next day in the hospital. Usually patients can put full weight on it right away, and our goal is to get them mobilized as quickly as possible. For the most part, they'll be in the hospital between 1 and 3 days, and then have outpatient physical therapy after that's completed.
Well, you know, here at OSI we have a complete facility that has physical therapy, as you'll see. We have an indoor heated pool for pool therapy. We also have a surgery center that provides a space for patients to get epidural injections and sort of other non-operative pain management modalities.
What is the most satisfying thing about doing what you do?
I think the most satisfying aspect of what I do is seeing patients come in who are terribly debilitated by their arthritis to the point that they're on a walker or sometimes even in a wheelchair. And then once you've treated those patients with a hip or knee replacement, seeing them back a couple months later in the office, walking without pain, that's truly rewarding. And I think if we look at hip and knee replacements in general, these are some of the most successful surgical procedures that we do today, not even within orthopedics, but across the whole spectrum of surgery.
So if our viewers would like to find out more information about the Orthopaedic Specialty Institute, where should we go?
We do have a website. It's osiortho.com, and the general contact phone number at OSI is 714-634-4567.